notch, this depression. Just almost 3-4 centimeter below this bony projection is the sternal angle. Okay. So this one is the sternal angle. This joint is known as Manubrium joint. Okay. And this body joins with the xiphoid process. This one is known as the xiphoid joint. Okay. See, this one is also known as jugular notch. This notch is also known as jugular notch as well as suprasternal notch. Suprasternal, why? Because above the sternum. So suprasternal notch. And here you will see the clavicular notch, from where the clavicle comes like this and the first rib goes like this. Okay. See in this figure. See, this one is the clavicle. As you can see, it is coming from it is joining and or articulating with the clavicular notch like this, and the first rib is going just behind the clavicle like this. So we usually start counting from the second rib. So the rib that is present above is the first rib. So we keep on counting like this. Okay. So this one is the clavicular notch. This is the articulation for the second rib, and we will see the articulation for the first rib as well. So this is the costal cartilage. These are the costal cartilage where the ribs come and attaches themselves. So this is the attachment for the first rib, just lateral to the Manubrium sterni, and the second rib attaches at the sternal angle. This is a demifacet. Okay, demifacet means it is not a proper facet. A facet is formed, a facet is basically a depression. Okay, so a facet is basically a depression in the bone. Okay, where the bone is attaching, other bone is attaching. So it is called demifacet because here the Manubrium sterni, suppose this is the, see, this is the Manubrium sterni, this is the body. So the lower part of the Manubrium sterni and the upper part of the body, they are forming this depression. This is not a proper depression. If you take the bones, like keep aside both the bones, they will not have any facet. The facet will only be formed when both the bones are placed together. Okay, so that is why it is known as a demifacet, where the second ribs come. So there are certain muscular attachments also in the sternum. So basically, if we see on the anterior surface, the whole part along with the Manubrium sterni, then the body of the sternum, whole is covered by the Pectoralis major muscle. Okay, on the lateral side of both the bones, on either side. On the lateral surface, there is Pectoralis major muscle. You have seen in dissection the Pectoralis major muscle? Have you seen? Okay, so this is the Pectoralis major muscle going like this. So this one is the muscular fibers of the Pectoralis major muscle, and just above this, this is the sternal head of sternocleidomastoid muscle. You have seen sternocleidomastoid muscle? Not in dissection. In your body, can you show the, yes, which one? This one is the sternocleidomastoid muscle. Okay, so this sharp muscle is the sternocleidomastoid muscle. So it is known as sternocleidomastoid because it is coming from the mastoid foramen or the mastoid process. So this is the mastoid process. Okay, this is our mastoid process. This bony structure is the mastoid process. From here, the mastoid part of the sternocleidomastoid muscle is coming and attaching to the sternal part. This is the sternal part. Okay, so together they form the sternocleidomastoid muscle. Okay. Now the sternocleidomastoid muscle's sternal head is attaching on the Manubrium sterni on the superior part just below the jugular notch, and on the xiphoid process there are some fibers of the rectus abdominis muscle. So the rectus abdominis muscle goes downwards like this. Okay, so up to the abdomen it prolongs. So the upper part only, here the rectus abdominis muscle, the upper part of the rectus abdominis muscle attaches on the xiphoid process and it extends like this on the downwards up to the umbilicus. So, and on the posterior surface, you will see muscle for sternohyoid, then sternothyroid, then here there are certain sternocostalis muscle also present, and there is a bare area of the pericardium that is just behind the heart. Okay, you are seeing the posterior surface. Okay, so if this is my anterior surface, just in front there will be superficial fascia, skin, that's all. Okay, muscles, certain muscles like the pectoralis muscles will be like this. After flapping out the pectoralis major muscle, we will see the sternum as well as the Manubrium sterni and the xiphoid process. So after removing this, on the posterior surface, obviously here will be the heart, okay, here will be the heart. So, and also the pleura will be like this, that is the lungs, our left lung, and the right lung will be like this. Have you heard of dextrocardia? Usually heart is right side, okay. So dextrocardia means heart is on the right side. So I am talking about a normal individual. So in normal individual, the heart is on the left side of the individual. So basically here will be the left lung, the left heart, here will be the right lung, okay. So just behind this there is a bare area of the pericardium. Okay, just remember only this much, that this is known as bare area of pericardium. Similarly, there is also a bare part of liver also. This will be covered in theory classes. So basically, this is the sternocleidomastoid muscle, sternocostal muscle, and on the xiphoid process on the posterior part, there is attachment for the diaphragm muscles. Certain diaphragm muscles also attaches here. Basically fibers. Okay, so that's the muscle attachment present here. Now certain relations. On the posterior aspect of the Manubrium, there is arch of aorta as well as left brachiocephalic vein. Okay, so posterior aspect of Manubrium is related to arch of aorta and its branches, and to the left brachiocephalic vein. So, and on the lateral part, it is related to lungs and pleura. What is pleura?
So covering of the body.
Covering. How many pleura are there? Two. Which one is the sensitive part? Parietal and visceral. Which one is the sensitive part? Okay, you read it, okay. So the body of sternum is also related to lungs, pleura and pericardium. Pericardium means covering of heart, okay. Xiphoid process is related to liver. So basically the xiphoid process is related to liver here, and this is the body. Behind we having the heart as well as the pleura, and the Manubrium. Here on the posterior surface is the arch of aorta and the left brachiocephalic vein. Okay. Now regarding ossification centers. So basically, what is sternothyroid muscle? Like why it is named sternothyroid or sternohyoid muscle? Sternum and there is no thyroid bone. Hyoid bone. Okay. Sternum and hyoid bone. And sternothyroid. So the attachment between sternum and thyroid cartilage. Okay. So in thyroid there is cartilage. Okay. So what is the importance of hyoid bone? Like if there is any fracture, when it gets fractured? What is the proper term for that? It's not. It is like, tell me in medical terms. What it is called? What? Hanging. Okay, hanging. So the suicide, I should not tell this, but I should not tell this in live, but the suicide term is for hanging, and strangulation. If a person is murdered, then it is strangulation. What is strangulation? Like if constriction is done from behind, like this. Okay. So to differentiate hanging from strangulation, we usually see for the hyoid bone, whether it has got fractured like this or fractured like this. Okay. If it is fractured inwards, then it is strangulation. You will study this in forensic medicine. Not important for anatomy part. If it is fractured inwards, then it is strangulation. That is, it is a murder. And if it is fractured outwards, then it is hanging. Okay, that one is hanging. So there are 6 centers. One is one in Manubrium sterni, and the other 4 in in the 4 sternibri, and another one is in the xiphoid process. So 6 centers. One in Manubrium appears in 5th intrauterine life, and 4 for body. First sternibra, there is 6th, appear in the 6th month of intrauterine life. Second, but sternibra 7th month of intrauterine life. In the 3rd one in 8th month, and in the 4th one in the 9th month. So basically in the Manubrium sterni, so after the baby is born, almost all part of the sternum gets ossified by puberty. But if it appears first in the Manubrium sterni in the 5th intrauterine life, that is in the mother's womb only. Okay, in the 5th intrauterine life. So usually there are 2 to 3 primary centers in Manubrium sterni. Okay, so I have written only one, but usually 2 to 3 are present. So one in Manubrium appears in the 5th intrauterine life, and this sternibri, yes, 6th, 7th, 8th and 9th. Okay, In the xiphoid process, the center appears by 3rd year of life. Okay, this is not intrauterine life. So after the baby is born, by the 3rd year, the primary ossification center for xiphoid process appears. So if a child, so why this is important? Suppose you are constructing in a plot certain building, and suddenly you got some skeleton remains. By seeing the skeleton, you can tell what is the age of the particular child or person. Okay, sternum is a very important bone for that. So, xiphoid process, the center appears by 3rd year of life and it ossifies by 40 years of life. So, your xiphoid process is not yet ossified. Okay, it gets ossified by 40 years of life. And this sternebra, these centers get ossified from below upwards and it gets completed by around 25 years of life. Okay. So fusion between sternal plates start from below upwards, begins at puberty and ends by 25 years. And Manubrium doesn't usually fuse with the sternum. If it gets fused, it is usually in 10% of the individual. If it gets fused, then the person is extremely old age person, like above 90 years of age. For example, this is around 90 years of age individual sternum. See, this has become a whole bone. Okay, so this is ossified. So now certain clinical part. So the sternum is a very important bone for bone marrow aspiration. Okay, so it is covered in front by cortical substances which is very thin in nature. So usually with a thick needle you can easily get bone marrow cells from here. Okay. So and there is certain other thing is, you have heard of epicardium cortis like this. Okay, so the sternum usually develops like this. Okay, in a child the sternum is usually like this, separated. Okay, so it starts ossifying from below upwards, sternum. If it cannot ossify properly or cannot unite properly, then the heart usually comes out. This is a condition. Okay, so this is one condition, and another one is, in certain individuals you will see that it is not united, simply not united. Heart is in its place but it is not united. So both the sternum plates are in different half. Okay, and there are certain terminologies also, pigeon chest, funnel chest. These are certain clinical condition. In case of COPD, bronchitis, in these cases you will see pigeon chests, funnel shaped chest. You will study this in medicine part, not important for now, but these are the things. So the sternum bone is usually affected in this. Okay, so that's all in sternum.